Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Muhamad Aly Rifai, psychiatrist and internal medicine physician, talking about his latest article, A Psychiatrist's 20-Year Journey with Ketamine. Muhammad, welcome back to the show.
Thank you very much for having me today to talk about a very important and timely topic to talk about ketamine treatment.
All right. So, talk about that article, but before you do, just tell us a definition of ketamine, get everyone on the same page, and then tell us
Sure.
your journey with it.
Sure. So ketamine is a compound that was actually discovered and FDA approved in the late 60s as an anesthetic.
Mhm.
It was also used as a veterinary medication for anesthesia for animals, and then it was approved by the FDA as an anesthetic. And it is recognized as an anesthetic that actually causes very little respiratory depression. So it's actually given for individuals in the emergency room or to neonates and kids because it causes significant calming effect and a retrograde amnesia. And it has actually also this kind of psychedelic-like effect. So it was approved as an anesthetic and was used in anesthesia for the longest and was very effective until people started noticing that when it was given for anesthesia, that it had this psychedelic effect where it elevated people and causes a dissociative effect. And we recognize that it causes a temporary blockade of the NMDA receptors. And that actually triggers a significant biochemical reaction and it works on the AMPA receptors. And we discovered that actually it had an antidepressant effect kind of in the late 80s and 90s. And so it became a focus of attention. But in its background, it's an anesthetic, it's FDA approved for anesthesia. And basically, we started studying it, and that was part of my journey. I was completing my residency at the University of Virginia in internal medicine and psychiatry in the late 90s. And then I actually did a work and a mini fellowship at the National Institute of Health in Bethesda, Maryland. And that was my first exposure to ketamine in a psychiatric realm because they were doing trials on ketamine with an intravenous infusion to see if it can relieve symptoms of depression. And the results were amazing. And this was around 2003 to 2006.
So we hear about ketamine in the mainstream media. So tell us clinically, how is it being prescribed and used today?
So when we started utilizing ketamine, it was mostly given intravenously. So ketamine in its formulation in the United States that are approved by the FDA, it comes in vials. So it is approved for intravenous infusion, and sometimes it could be given intramuscular. So our work at the National Institute of Mental Health, we actually found out that intravenous infusion of ketamine at low doses, they're not the anesthetic doses, and the doses were 0.5 milligrams per kilogram up to 1 milligram per kilogram, which is different than the anesthetic doses, which is around 3 to 4 milligrams per kilogram. So minimal doses of intravenous infusion cause a significant antidepressant effect. A lot of the colleagues that I worked with actually at the National Institute of Mental Health went actually to pharmaceutical companies and they basically isolated the two isomers. So ketamine, racemic ketamine, which is the compound that's in the vials, has two compounds. It has a right-sided isomer and a left-sided isomer, esketamine and R-ketamine. And so they basically focused on esketamine, and Johnson & Johnson, Janssen Pharmaceutica, developed it later on. And they utilized it as an intranasal formulation.
Mhm.
And in 2018, 2019, it was FDA approved as a treatment for depression under the brand name Spravato as an intranasal treatment. And that was the first FDA approved indication for ketamine in any form for depression. It later on was approved for treatment of suicidal ideation in the context of depression. And now it actually has an indication as a mono treatment for major depression. At the same time, a lot of people continue to use intravenous ketamine. I'm talking about the racemic ketamine. And then they actually also started utilizing it mostly in intramuscular injections, which from my research at the National Institute of Mental Health, we found out it has equal efficacy for intravenous infusions. Additionally, also, people and pharmacies started developing other formulations for ketamine, mostly in lozenges and tablets that they utilize. And this is all off label. And it was formulated by pharmacies that basically just formulated it for use. And we now know that basically the amount of ketamine that gets into somebody's bloodstream from these formulations is pretty low.
Hmm.
So right now in the United States, what's approved for the treatment of depression is only the esketamine compound, mostly is in an intranasal spray. The use of intravenous ketamine and intramuscular ketamine, as well as the lozenges, is all off label. So that's kind of just the kind of the lay land of what's available in right now. I talked in the article also about some formulations that are actually gaining momentum in terms of FDA approval. And with the change of the administration, changes at the FDA and HHS, there is significant interest in pushing for other formulations of ketamine as an alternative to antidepressants, and just because it's a psychedelic compound also. So basically, there are fast track approvals for intravenous ketamine for the treatment of depression. There are fast track approvals for intramuscular ketamine for pain management as well as treatment of depression. And there are also clinical trials for utilization of R-ketamine in a tablet form for the treatment of acute depression, either with antidepressants or alone also. So there's a lot of kind of movement right now in the field of ketamine with new products that are being available because of the significant interest and because the focus of the current administration and the FDA is to go away from SSRIs and antidepressants to other compounds that could be helpful for individuals with depression.
Now, talk to us from the patient perspective. How often and what's it like for them when they're taking the intranasal esketamine along with the IV version ketamine? How often do these medicines have to be given, and what can patients expect after taking these medications?
Sure. So when we started the intravenous ketamine, when we gave it at the National Institute of Mental Health, it was for infusion over 45 minutes, and it was an intravenous infusion. And the patient prepared like a surgical procedure, so the patient was without food or drink for at least 12 hours prior to the infusion. The patient was hooked to a monitor, and this is what I do in my office. We monitor them closely. They're hooked to a blood pressure monitor and a pulse oximetry and sometimes heart monitoring. And basically, they're monitored for up to 2 hours. And then they go home. I mean, they have to have somebody drive them, so they're not able to drive. This is for the intravenous ketamine infusion. And most centers continue to do that. Sometimes the monitoring may be a little bit shorter. And so based on those parameters, the Food and Drug Administration established a REMS program, risk evaluation and mitigation strategies program for Spravato, the intranasal spray. And so there's this program. Patients are enrolled in this program. Clinics that administer the medication are enrolled in this program. And basically, the patient is MPO before they receive the intranasal Spravato spray. And then they're monitored up to 2 hours in a clinic with blood pressure monitoring, heart rate monitoring, and continuous monitoring as they receive those doses. Again, somebody has to drive them home. They may be a little bit sedated. But from the patient's perspective, a lot of patients feel that the medication significantly improves their depressive symptoms. A lot of patients swear by it, that they have a lifting of the veil or the cloud of depression that engulfs them when they receive ketamine treatment. It also sometimes is used off label for other psychiatric disorders, such as post-traumatic stress disorder, anxiety. So it has been utilized, and patients see a lot of benefits from the medication. For Spravato, we have seen that most patients actually will derive significant benefits but we have seen that a lot of patients will continue to need periodic nasal spray sessions of esketamine, Spravato, and it varies depending on the severity of the patient's condition. We've seen the same things also with intravenous infusions. The effect may plateau, but patients may continue to derive benefits from the continued infusion that they get, both intravenous ketamine as well as intranasal ketamine. So the benefits are pronounced, they're significant. We also see significant benefits in, for example, in individuals who experience suicidal ideation, where intranasal esketamine is approved and the patients derive significant benefits from that because it leads to the complete resolution of suicidal ideation within hours. So what I see is basically the administration of ketamine should only be administered in a protective setting. And we've had in the news the unfortunate situation of actor Matthew Perry, who lost his life after using multiple substances, including ketamine, which he received through lozenges and other formulations, and he combined it with other substances. So the use of ketamine could be dangerous if it's not in a supervised and monitored clinical setting.
Now, how durable are these effects, and how often do patients have to come back for repeated treatments?
So it varies with patients, but there are some patients that will require weekly treatments. The initial protocol, for example, that we did at the National Institute of Mental Health for intravenous ketamine required intravenous infusions up to 3 times a week for 2 to 4 weeks. That was the protocol, and we saw significant improvement in terms of the symptoms of depression within hours, and within days the patients were much, much better. But we've also seen that once a patient is stable, sometimes they may require maintenance treatments, both with intravenous as well as intranasal ketamine. And there are patients that require monthly, weekly, or biweekly ketamine treatments, whether intravenous or intranasal, to maintain this antidepressant effect that they derive from ketamine. And the longest, we have patients who've been on treatment for several years, and they continue to derive benefit from ketamine.
So in a primary care setting, are there specific types of patients who may be better suited to ketamine versus an SSRI?
In terms of a primary care setting, I think a referral to a psychiatrist for them to have a discussion about ketamine. So ketamine could only be administered in a psychiatric setting. Now, I know, of course, there is this publicity about freestanding ketamine clinics that are managed by anesthesiologists, where it's only a medical model where a person comes in and they receive intravenous ketamine, and there's very little kind of psychiatric input into the treatment. And that is usually not recommended just because of the complexity of this issue. Though I know that's throughout the United States, there's many, many ketamine clinics where it's only a medical model, anesthesia model, without input from psychiatrists. But I think an input from a psychiatrist, as well as involving a therapist where there's a preparation for the session, because the session leads to a dissociative effect. People feel like they're free floating in the air, and then they have a dissociation, and they have catharsis related to whether there's trauma or depressive symptoms. And unless there is pre-work for the session, consultation with a therapist, and kind of after session work, sometimes that benefit could be lost or not maximized if there's no involvement from a therapist. So I think referral to a psychiatrist would be the most productive avenue for a patient who's experiencing severe depressive symptoms in terms of not wanting to take antidepressants. But now with ketamine being approved, FDA approved in the nasal spray format as a monotherapy for depression, that is an option also for a patient who does not want to engage in antidepressant medications.
And in terms of complications and potential side effects of ketamine, what do we have to look out for?
So sedation is the main side effect. Unless there's a high dosages, respiratory depression is very, very unheard of. Elevated blood pressure is one of the main side effects that we monitor for in the clinic, and sometimes tachycardia could happen, but that's why we monitor for these things. And there transitory and self-limiting, and they return to normal after the treatment. Of course, there's sedation afterwards, and sometimes the dissociative effect could be alarming and frightening to people, and sometimes they have adverse reaction to that. But preparing the patient for that, what's going to happen in the treatment, is very, very important. But I think that we see that most people have the treatment without any significant side effects, and it's been long term, and we haven't seen any significant side effects. And the REMS program has good data to show that it is safe and could be administered in a monitored setting.
We're talking to Muhamad Aly Rifai, psychiatrist and internal medicine physician. Today's Kevin MD article is A Psychiatrist's 20-Year Journey with Ketamine. Muhamad, let's end with some take-home messages they want to leave with the Kevin MD audience.
Ketamine is an effective treatment for depression and for individuals who have not benefited from antidepressant medications for depression. It has produced a dramatic improvement in depressive symptoms, that the improvement that is rapid and effective. It is coming in the future in other formulations that are going to be available to patients. But now currently it could be used in an intravenous form, that off-label. It has a nasal spray form that is available with an FDA approval for the treatment of depression. It is effective. It is helpful for our patients. It relieves depression and suicidal ideation, and it offers great hope to individuals who are struggling with symptoms of depression.
Muhamad, thank you so much for sharing your perspective and insight, and thanks again for coming back on the show.
My pleasure. Thank you.